At Texas Health Action, what we want to be is that trusted provider, that safe and affirming space with an expertise in serving LGBTQI+ people and people impacted by HIV. So Kind Clinic was founded on that HIV prevention through PrEP component. That was one of the most significant health issues to our community. And I think the most brilliant part of the name of Kind Clinic was this idea of kindness. Healthcare and accessing healthcare wasn't always kind to people, and it doesn't have to be that way. I mean, as the kids say, that's a choice. We're gonna choose something else. We're gonna do it differently. If we're kind to our patients, we change that relationship. And that's how we want to approach our care with our patients and with our communities that we serve.
I think kindness is about a lot more than just being nice to patients. I think it's about designing a system around the patients and understanding the parts of the system that are difficult for people to navigate. The best care in the world could be right next door to you. It does no good to you if you can't access it. And I think making sure that it's accessible to everyone, not just in terms of where they live, but how they access care. Some people want to come into a clinic. Some people don't want to come into a clinic. Some people can't come into a clinic because they live too far to access affirming care like we provide. And so I think we've built a lot of really intentional connections once you're in care to patient support, financial services, our clinical team. And those things are all what I think makes Texas Health Action a little bit different.
The Kind Patient Assistance Program, or KPAP, does a whole range of services. So it provides assistance for medication access, for transportation, for copays like their lab work or their provider visits. We become the bridge. So we speak the language of the system. We can understand and see common problems with insurance and think of a couple of different ways that we can approach it depending on the situation for the patient. So it's very tailored. Kindness isn't soft, it's strategic. It's being able to look at all these hurdles, these red tapes, and then turning it into opportunities of education, opportunities of connection, opportunities of being seen and cared for, and knowing that you deserve that.
Creating an affirming space can create a really positive patient experience, specifically within Kind Clinic, since we can't guarantee that they'll be affirmed any other place. Showing kindness, especially the consistency of the kindness, is hopefully something that's going to allow the patients to feel the comfort and the genuine sincerity of everything that we're here to do for them. Ultimately, I love to see the moments when the patients open up and are a little bit more candid than might otherwise be in a stuffy medical office setting.
I think serving more than 25,000 patients across Texas really speaks to the level of need. But I think it also speaks to the fact that when you make care accessible and affirming and easy to access, that people will show up. It takes a lot of pieces. It's about having good clinical care that's easily accessed with the right amount of help. It's all kind of coming together to make it easy, to take away one more thing that people don't have to worry about in their day.
When you're facing a world of just abject cruelty, being able to have a place that you have kindness at the forefront, you can see this whole journey of the patient and you're rooting for their wins. You are facing and experiencing the same challenges together. You see a patient from day one could be a little cautious, a little nervous, to the light bulbs start kind of brightening up. They start feeling way more empowered to advocate for themselves, be able to ask us very nuanced questions that they wouldn't be able to do day one.
As a member of the LGBTQIA+ community, I recognize and remember what it was like growing up and having the things that I was too scared to say to someone. Being able to help break that down and work in a place that no one ever walks through the doors and is fearful of asking or saying something to us. That's what's most important to me, because we want patients to be comfortable. We need them to be comfortable.
Our queer community has always had power in it. The healthcare between our patients, our providers, and our community partners is making that possible. Putting all these things together, it is unleashing that power within us so that we can be our most authentic, best, most fabulous, vibrant selves.